Hi, my name is Richie Eppink. I am a lawyer and the legal director of the American Civil Liberties Union of Idaho, the ACLU. I am also one of the lawyers, along with James Piotrowski, for all of the adults with developmental and intellectual disabilities in the Medicaid DD programs in Idaho as part of the KW versus Armstrong lawsuit, which is a class action lawsuit that sought to improve and change things within the Medicaid DD program in Idaho. This is Chapter 3, which is about seeking review or seeking some additional consideration after you've made a determination or suspect that there might be something wrong in the budgeting process. Part of the suitable representative's job is not just to help an adult in the program with the process of actually appealing a decision, but also helping them make the decision about whether to appeal or seek some additional review in the first place. And so in this chapter, we'll be talking about how to make that decision as well as how to pursue an appeal after you've made the decision that it makes sense to appeal. So there's 3 keys to success in doing all of these things. One is knowing how review works. There are several types of review, and we'll talk about all of those in this chapter. Secondly is making the decision about what issues to appeal. There are some things that can be corrected through the review process, and there's other things that can be corrected or have to be addressed in other ways. And then finally, we'll talk, of course, about how to bring the appeal itself, how to prepare the appeal, get ready for the different review processes, and if necessary, get ready for an actual hearing. The types of budget review that they're available. After you get that eligibility notice with the budget information and all of the attachments that James has talked about in Chapter 2, there are 3 types of review that you can get. One of them is called informal review, another one is called extended informal review, and a third is the actual fair hearing that some of you may already be familiar with. Let's talk about informal review first. Informal review, and again, this is just a name that the Department of Health and Welfare gives to this process. It's not necessarily informal in the way that we speak normally, but that's what the department calls it. And so you'll hear it talked about as informal review. Informal review is a process by which the staff at the Department of Health and Welfare evaluate an appeal request, a request for a fair hearing, to see if they agree that there should be a change without having to go to a fair hearing and asking a hearing officer about it. That's what informal review is. Extended informal review is a new process, a relatively newer process that came about as the result of the KW versus Armstrong lawsuit. And this allows you to get some review of a budget and a plan even after the plan has been submitted. So as you know, usually you get the budget notice and then you have an opportunity to appeal that budget, and then later on down the road you have to submit a plan within that budget. It used to be that you had to make the decision about whether to appeal the budget within a certain period of time after the budget notice was received. But now you can still appeal that budget even at the same time that you submit a plan. And that's what the department calls extended informal review. It's still the same process, basically, where Department of Health and Welfare staff are deciding whether or not they agree that there should be some change to the budget, but we call it extended informal review, or the department calls it extended informal review because it's comes at a later time than the initial informal review that comes after you submit an appeal. The third process comes after both of those things have happened, or at least the opportunity for both of those things, the informal review, extended informal review. The last thing that might happen at the agency level at this point is what's called a fair hearing. And in this part of the process, rather than a Department of Health and Welfare staff looking at this, an independent hearing officer will hear the case from the department and hear your case that you present and make a decision about whether there needs to be a change made to the budget. Let's talk about when to appeal. There are some times when it makes sense to appeal, and there's other times when the appeal process is not going to fix your problems. The only time to pursue an appeal is when there are facts or circumstances that warrant an appeal. Here's some examples of times when you would want to appeal. If there are errors in the assessment, if in the inventory of individual needs or in the SIBR process there was an error made in the assessment, the assessor made the wrong decision or the assessor misunderstood information that a respondent was sharing, that would be an example of when to file an appeal. Or the assessor, after they've made all their decisions during the assessment process, they have to transcribe that information, enter that information into the budget tool itself. Sometimes, of course, there will be times when the assessor types in the wrong information inadvertently, and if you figure that out, that would be another example of when to appeal. There's also now, because of the KW versus Armstrong lawsuit, everyone is able to ask to have their budget increased because it's not enough to satisfy all of their health needs or their safety needs. We'll talk about what those are and how they're defined later on in this chapter, but even if there were no errors in the assessment process and everything was transcribed correctly, you still may want to appeal in order to access the opportunity to get a higher budget because of a health need or a safety need. Let's talk about errors in the assessment itself. As James covered in Chapter 2, there could be errors in the assessment itself. Those errors could be a decision where the assessor either understood something incorrectly from a respondent or the assessor relied on information that was inaccurate or incomplete. That would be an example. Also could use an inappropriate respondent, someone who doesn't know enough about the adult involved in these decisions or doesn't have information about a particular question in order to answer those questions correctly so the assessor has accurate information. A third reason, of course, is if the assessor relied on the wrong source of data, maybe something that was outdated or something that had been done without enough safeguards to make sure that it was correct. If you spot any of those things in your review of the materials that come in the eligibility packet and other information that you know about an adult, those would be errors in the assessment that would be a really good reason to file an appeal to make sure that that gets corrected. Other examples of some errors that may flag reasons to appeal: if you see a large change in the results of the SIBR, that's a cue for you to investigate whether or not those changes actually reflect a change in the adult that we're talking about, or whether instead they reflect an error that was made in the SIBR process. The inventory of individual needs is a tool that the Department of Health and Welfare developed itself, so sometimes there'll be errors in the process of making those decisions by the assessor that will translate directly into errors in the budget. If you spot any of those, again, another reason to file an appeal. Any of those errors in the assessment processes are exactly what the appeal process is designed to correct, so all of those are reasons to ask for a fair hearing to begin the informal or the extended informal review process. Errors in transcription, I mentioned those earlier. You'll want to look at the handwritten and other notes that the assessor made and compare those to the inputs that were actually put into the budget calculation tool. If you notice that those things were translated incorrectly, transcribed incorrectly, those are reasons to appeal as well, of course, to correct those errors. And then even if there were no errors in the assessment process, even if the inventory of individual needs was done correctly, the SIBR was done correctly, and there were no transcription errors, you might have a budget that's accurate according to the Department of Health and Welfare's tool, but that doesn't necessarily mean you have a budget that's adequate to meet the health and safety needs of the adult that you're representing. If you can't find any errors, but yet there's not enough money in that budget to meet all the health needs and all of the safety needs of that adult, that is another reason to appeal, to access those health and safety process so that you can ask for more money even though the budget may be calculated correctly. If a participant cannot safely and effectively be served by the budget that they have, then a healthy safety need is something that you'll want to document as part of the appeal process so that you can access more budget funds for that participant. So let's focus for a moment on the health and safety criteria. This was another product of the KW versus Armstrong lawsuit, and so we now know what these things mean and what the department is supposed to be looking for when it's looking at health and safety needs. So health is defined as the prevention or deterioration of physical or mental health or cognitive functioning or an increase in maladaptive behavior that's related to the adult's disability. That's what health is when we're talking about health in this appeal process. Safety is the prevention of criminal activity, destruction of property, or injury to harm yourself or others. Now, of course, there's a lot of overlap between these two things. And so sometimes you may have effects that a budget has or an inadequate budget has on an adult that's going to be both a health need and a safety need. In fact, that is not going to be uncommon at all. But those are defined separately, and you get to show reasons why the budget should be increased for each reason. You don't have to show both a health reason and a safety reason. You can show a health reason to get a higher budget or just show a safety reason to get a higher budget. Health focuses on an individual's condition as it relates to their disability. Safety focuses more on the effects of those changes on someone's behaviors. And again, as I mentioned before, there will be some overlap. There is some overlap between those two concepts. Let's talk now about how to appeal. You have some options here. So first, you can use the appeal form provided. In Chapter 2, James talks at length about that appeal form, and it's part of that budget notice. You don't have to use that form if you don't want to. You can just write a letter, so long as you make it clear that you are appealing a budget decision. You'll want to make it clear not only that you're appealing in that letter, but what you're appealing. So you'll want to refer to that budget notice, or ideally even attach it. You can provide supporting documentation, and there's really good reasons to do that at the time that you send in your appeal request, but you don't have to. So you can just say, I appeal this because I don't think the budget is adequate, or because there were errors in the assessment, or you can say those things and also attach documents, provide documents right at the get-go, so that you can make sure the department sees those things from the very first part of the appeal process and the informal review process. You'll want to, of course, request the right remedy. Again, talking about a letter of appeal, you don't have to say anything in particular. You just need to say in a general fashion what you're appealing and why. Those are the two crucial examples, and you can look at the written materials for an example of that. Documentation, if there's something that's obvious, that's a good example of when you may want to attach that documentation at the same time that you appeal. But again, you are not required to attach anything to the notice of appeal other than writing out that you want to appeal and what it is that you are intending to appeal. Requesting the right remedy. I mentioned this earlier. The purpose of the appeal, when we're talking about these budget appeals, is to get an increased budget for use by the participant. The goal here is not just to increase the budget. The goal is to increase the budget in a way that's going to be meaningful, that's going to allow the adult that you're representing to access services that they need that they wouldn't be able to otherwise get with their lower budget. So the services that you want under the higher budget still have to comply with the Department of Health and Welfare's rules for plan approval. So they have to be approved, they have to be available Medicaid services in the DD program, they have to meet all the prior authorization criteria, that's the plan approval process, and they can't be duplicative, they can't be cosmetic, and they can't be solely focused on the economic needs of a provider or the family. So they have to meet all those other requirements. But if they do, and you need more budget to access them, that is a reason to appeal, and that's the kind of remedy that you can achieve through the appeal process. Let's now talk about how you win an appeal. There's no magic words in an appeal. This is not about what you say entirely, solely. It's not necessarily about the ultimate need or justice, unfortunately, for the adult that you represent. It's about what you can prove to the department and ultimately to a hearing officer. So because of that, just because something needs to happen because it's right, we have to translate. You as a suitable representative are the key person to translate what is right into the proof that will get us there. And that involves a lot of preparation. The key to winning an appeal is gathering documents, learning information, assembling that information in a way that makes sense and that can persuade somebody to do the thing that is right. Unfortunately, just by telling a hearing officer or the Department of Health and Welfare staff what is right is not going to persuade them on its own. You're going to have to back it up with documents, with witnesses, and in a logical and persuasive way that hopefully convinces them to do the right thing. So preparation is the key. Let's focus on preparing for and succeeding in an informal review. So if you think you can win on informal review, like we were talking about earlier about supporting documentation, this is the time to submit the best information and documentation that you have to the Department of Health and Welfare staff who will be reviewing your client's case at the informal review stage. So gathering up the documents that, for instance, show a health need, show a safety need, or show an error at some point in the assessment or the budgeting process are what you're going to want to put together and submit either with your appeal request or shortly after you submit your appeal request to be considered during the informal review process. If you can show and persuade the Department of Health and Welfare staff that there's been an assessment error or that someone needs an increased budget due to a health or safety need just from those documents alone, then you will win at the informal review stage and you won't have to go to a hearing. So let's talk about how we prove an error in the assessment process. So there's three things to look at. You want to look at the respondent, look at the records that were used, and look at the process of assessment itself. So the respondent. So the respondent's the person who answered the questions during the assessments, answered the inventory of individual needs, answered the questions that the assessor asked during the SIBAR assessment. And you'll want to review to make sure that the answers that were recorded by the assessor were recorded correctly, but also make sure that you understand who the respondent was. If it was somebody that you don't know well, it's probably worth a phone call to them to determine whether or not they have enough information and had enough information about the adult that you represent during the time of the assessment in order to give complete and accurate answers to the assessor. If a poor respondent was used by the assessor, somebody who doesn't know enough about the person to be able to give accurate answers, that is not only a reason to appeal, but that can help you prove that the assessment was done incorrectly itself. So another thing that you'll want to look for is whether or not an answer that the assessor recorded in the SIBAR, for instance, or in the inventory of individual needs doesn't reflect what this respondent believes or what the respondent told the assessor. So you'll need to know what the respondent remembers telling the assessor and what the respondent believes about the adult you represent and compare that to what the assessor actually wrote down in the SIBAR booklet and in the inventory of individual needs. You can also look at other records to show that they are contrary to what the assessor determined. So if there's a medical report or some other documentation maybe mentioned in the medical social history or otherwise that contradict what the assessor decided, that would be another example of how you could prove an error in the assessment process. So assessors are allowed to rely on outside sources beyond the respondent, but this can be challenged if that decision based on those outside sources contradicts what the adult's actual conditions and needs are in reality. So another place to look, in addition to looking at what happened with the respondent and the assessor, is to look at additional records. Obviously the medical social history is a place to start with that, but also medical records, assessments by psychiatrists or psychologists, or other documents that diagnose or talk about your client's needs and behaviors. So gather those. Some of those may be documents that the adult already has or that their family already has. Some of those you could request from healthcare providers and others. And if you can show that those contradict decisions that the assessor made as part of the Inventory of Individual Needs process or the SIBAR process, those two could be used to prove an error in the assessment process. And you can look at the process itself for evidence to prove an error in the process. So the SIBAR, for instance, has very specific instructions that have to be followed when it's administered. You'll want to look at whether or not those instructions were followed. If you were not present during the assessment, you'll want to talk to the respondent who was to determine whether or not the process was followed correctly. There's not supposed to be any distractions during the SIBAR. The respondent is supposed to be appropriate, which we talked about earlier, and the answers should be given as to the adult if they had no help or supervision. So if the respondent is answering the question as if they had all of the services that they are available to them now, that would be an inappropriate administration of the SIBAR, and that could be used to prove a problem with the assessment process. If there's, for instance, problems with translation, you have a respondent who's not very proficient in English, that is another example. And if, even with respondents who are proficient in English, did they understand what questions they were answering, and did the assessor understand what the respondent was telling them? Let's talk now about health and safety needs and start with health needs. The health and safety criteria that the department has adopted define what health and safety needs are and establish how you can prove that your client has them. You have to use documentation to establish these needs. The purpose of all of this is that where a health or a safety need exists that can't be met with the existing budget, the budget should be increased, and that's the purpose of the health and safety criteria. Documentation. For a health risk, the documentation that you're going to have to get to show a health need is written documentation from a licensed practitioner, some sort of professional that's licensed by the state of Idaho, whose recommendation or information is within the scope of their license. That's what you need. You need to find a professional who has a license issued by the state of Idaho, and their recommendation or what they're saying about your client has to be within the scope of their license. And for a health need, what you have to show, what that documentation from the licensed professional has to show is two things. One, that the current physical, mental, or cognitive condition of your client may deteriorate or their behaviors may increase if they have to use only the services that are available within their existing budget. And second, that documentation needs to show the specific supports or services, not just they need some additional services, but the specific supports and services that would address that need. So here's a tip. Ask the professional, the licensed professional that you are working with to get this documentation to be as detailed as possible about why the need exists, about what will happen if there's not additional services made available, and how exactly those additional services will correct the problem. The more detail, the better, the more likely that you'll be able to succeed at informal review or at hearing if you have to go to it. So let's move on from health needs to safety needs. Remember, you can show both of these or you can show just one of them. So proving a safety need also requires documenting a specific need. You have to use documentation to show a safety need, just like with a health need. The documentation that you can use for a safety need includes current incident reports, police reports, assessment from a licensed practitioner or professional, or status reports or implementation plans that reflect the interventions that are needed to prevent something that we want to make sure is not going to happen, a safety risk that we want to make sure is not going to happen. You could use a status report or implementation plan to show that. So to show a safety need, you have to establish A, an imminent or likely safety risk, B, specific supports or services that you're requesting that are going to address that risk, and C, that those supports or services are actually likely to prevent that risk. So how do we do all of these things that we're talking about? How do we assemble this proof and get ready for informal review and for hearing? You're going to want to create an appeal packet. So once you've done your review of the respondent, the documentation, the process, health and safety needs, and determine what you want to prove, you're going to build a package of materials so that you can clearly set out and prove your case. You're going to want to have this with you as you work on the case and adding to it as you go along and you find out other things that you can use to persuade the Department of Health and Welfare staff and the hearing officer. So every appeal packet in every case should include at least these things: the budget notice, the budget calculation spreadsheet that comes with that notice, the SIBR information, not just the SIBR report, but you should request that SIBR booklet that's used to complete the assessment, the medical, social, and developmental history document that the Department of Health and Welfare and the assessor produce, the inventory of individual needs, and the appeal request, the notice of appeal that you sent in to kick off this whole process. Some other things that you should consider including in that appeal packet are things like these: medical records, treatment notes, treatment charts, incident reports, letters and statements and reports from providers, police reports, legal and court judgments, budgets from previous years, the SIBR from previous years, the answers, the SIBR booklet from this year and from previous years, and of course any other document that you've identified might help you convince somebody that this budget needs to be increased.